For the first time in our nation's history, thousands of previously successful medical practices now face bankruptcy. Doctors in the United States face growing difficulties just keeping their office lights on. The United States as a whole has a shortage of 20,000 doctors, with less than 1/2% of America's population. Hawaii has 7% of the country's entire physician shortage. All the problems facing doctors in the continental United States also face doctors in Hawaii, but they are just the beginning of problems facing doctors in Hawaii.
The state of medicine in Hawaii is approaching apocalyptic. It's the period of greatest change that we've had ever.
It's getting tougher and tougher for doctors to make a good living in Hawaii, and tougher for the patients to get the medical treatment they need, because too many doctors cannot afford to practice and live in Hawaii.
There is a shortage of doctors, and I understand in a few more years, by the year 2020, we're actually going to have a shortage of about 1,500 physicians.
We do have a doctor shortage here to start with, and the few doctors that we do have here are hesitant to get into the workers' compensation market. So that has a severe shortage.
This morning I checked, we have 51 employees, down from 78. We have only 5 clinics. 6 or 7 months ago, about 6 months ago, I was called into Dr. Sewell's office. Dr. Sewell is the medical director for the medical group, and Janet Liang is the director for the insurance side of the, Kaiser Permanente. And they said, Dr. Gackel, we've been looking at the budget, and it looks like you have not been able to make a break even now for 3 or 4 years. He told me basically that if we cannot make bottom line at the end of 14, that we will be history. So if you see me here, think of me as Straub and Honolulu Medical Group as they were before. They had to close their doors.
What ended up happening there is, doctors are not like businesses. They don't kind of watch. They don't watch. They're kind of poor businessmen in some respects. The doctors that has a few workers' comp here and there, they didn't drop out right away, but they dropped out slowly, and there was an insidious drop in doctors. And I did a survey on this about 5 years ago. How many doctors dropped out? How many doctors that had done workers' compensation before that were willing to take it as part of their practice? Over 60% had dropped out.
The problem we have here is our cost of living and our cost of doing business.
Hawaii is more expensive than most anywhere else to live, and physician wages are generally lower than most anywhere else.
All of the solutions that have been put forward do not begin to scratch the surface of the problem. We have a shortage of the ability to care for people that is so profound right now. We have such a shortage of primary care docs who are really the healthcare system.
It's evident to me and to a lot of people that the solo practice, they're not going to be able to make it with affordable care, that it's going to be too expensive. So they're going to be forced to either become employed physicians of the hospitals or some of the big clinics, which is kind of what we're seeing at this point. Or the older guys they'll just close their practices and have a good retirement.
I'm a little bit of a typical private practitioner here in Hawaii. I'm in a non-group practice. I'm located fairly close to a major hospital, but I'm also a dying breed. I'm actually a breed that may not survive. Practitioners such as myself actually can't afford the overhead. My young colleagues are choosing to go elsewhere. They're going out of private practice. They're deciding not to practice it within the state of Hawaii, much less the neighbor islands.
Most practices are struggling. While in the 90s there was a big run on purchasing primary care practices, it's not the case today.
And we're over 700 physicians short, and we'll be about 1,400 to 1,600 doctors short by 2020.
That 600 number is rising. We haven't been able to recruit physicians in here to meet that need. We haven't been able to retain physicians here, to bringing physicians in, training them, and then getting them to stay here once they're done. That's the big challenge. How do we get them to come back to the state? And that's where we really haven't found an answer yet. My colleagues on the mainland, when I tell them we have a physician shortage, they can hardly believe it. Who wouldn't want to live in Hawaii?
We don't
put out enough doctors at our med school to adequately supply the citizens of Hawaii with the doctors they need. So we get a lot of doctors from the mainland because it's an attractive place to live, it's a pretty safe place, you know, great weather. And then some of the minuses that people discover are a house costs 4 times what it was where they came from. Airfare is expensive, getting back and forth. Family is on the mainland. It's difficult to visit. The perception is that public schools aren't very good. So if you have 2 kids going to Punahou or Iolani, you're paying $40,000 or more a year for that.
And we still have this problem with reimbursement here. Everyone knows it. You know, graduates know it, and sometimes they know it before they graduate. Other times they know it if they move here and try to practice here, and they see the people that they've graduated with, their classmates, making it basically, and they're having problems paying back their debts on what their reimbursement is here.
The problem we have here is our cost of living and our cost of doing business, which is about 30 to 35% above the average on the mainland. Say compare Honolulu to San Francisco or LA, or really any of the big cities, Chicago, New York, Miami, where we make far below, about 30%, 30 to 35% below where other big cities physicians are being paid.
As low as 48th out of 50 states in terms of reimbursement, and you know, we're probably first or second out of 50 states in terms of how expensive it is to live. The glossy brochures and prospectuses of insurance companies are often misleading and not accurate in terms of what really happens in practice.
Last year, the year before, the 3 top executives at HMSA were making 7-figure incomes, which seems remarkable for taking no risk, just, you know, as administrative positions.
100% the insurance companies are definitely more focused on the bottom line and profit margins and that sort of thing, as opposed to what's best for the patient.
Jump through hoop after hoop after hoop after hoop after hoop.
Let's be honest, insurance is a business. It really doesn't have anything to do with health care other than the fact that that's what they pay for. Physicians, they're not interested in the business practices of medicine, and that's kind of the opposite when most of the administrators are trained in the practice of business.
The insurance companies have made it very tough on physicians, and specifically for those physicians who directly dispense medication to their patients through workers' comp. That's the area that I've seen a lot of, and I've seen how difficult it is for physicians to be able to collect the statutorily mandated amounts that they're supposed to be reimbursed. The insurance companies are simply disputing it and simply not paying the amounts that they're legally obligated to pay.
I don't understand how we got in the business of having insurance companies pay the doctors for the medical care. Why should the insurance companies get all the money? They're not providing the medical care.
You know, is it broken? Yeah, everybody thinks that, you know, doctors included, think that the medical system is not working.
When we reform the insurance company premiums, then we'll have something to talk about.
The private insurance reimbursement model is literally built on a system of foisting huge overhead on small medical practices. The great length of time between the doctor visit and the payment, often many months, strains doctors' budgets. Most of the doctors who have left Hawaii in recent years have cited insurance industry business practices as a principal reason for their departure. So far, the insurance industry players have steadfastly refused to even admit that they're part of the problem. Physicians feel the pressure in their patient care and in their bottom line. Patients feel the pressure in their lack of care and in coverage battles with insurance companies. Companies know that they are being cheated in their health insurance budgets. But, with a few rare exceptions, Hawaii's legislators have not taken up the issues of their constituents. Rather, they've listened to the insurance company hired guns who've convinced them that their clients know medicine better than the doctors. Their role is to keep chipping away at the obstacles in the path to the healthcare insurance industry's plan for the future. Doctors clearly understand what legislatures in Washington and Hawaii don't. That a piece of paper that says you are covered by insurance doesn't necessarily translate to the actual medical care. The major problem is politicians equating health insurance with health care. Insurance companies are often barriers to reforms that would give patients tools to find and negotiate for more affordable and higher quality care. The crucial issue for doctors is that third-party payment by insurance companies instead of direct payment by patients not only increases the cost of care by adding compliance costs, but also hands over control to the insurance companies to micromanage treatment through the power of the purse. Researchers at the John A. Burns School of Medicine at the University of Hawaii have found the MD shortage statewide is getting critical. There are currently less than 3,000 physicians practicing in Hawaii. A third of them are 55 or older and approaching retirement. The shortage is expected to increase to a deficit of nearly 1,500 physicians by 2020. This doesn't bode well for Hawaii's population, which already has less access to care than it needs and steadily losing rather than gaining access, resulting in delays in care, higher cost, and worse outcomes. Access to health care is the timely use of personal health services to achieve the best possible health outcomes. This definition underscores the importance of timeliness as a feature of good access to care. Hawaii's current healthcare insurance industry rules and regulations refuse to recognize the imperative of timely care delivery. This short-sightedness degrades the medical care the insurance policies promise to provide patients. It cheats the employers who purchase the policies and bankrupts the physicians trying to deliver the promise. There will be dangerous consequences of this steadily expanding crisis. People are not getting the medical care they need. Private practice doctors are being forced out of business. Hawaii is known as the health state because employers are mandated to pay for most of the cost of health insurance for their workers. But the companies are not getting the coverage they're paying for. They need their workers to be healthy and well cared for, to ensure their productivity. Employers and workers deserve to get what was paid for.
The only real chance you have to practice medicine the way you truly want to is to run your own business and clinic and then make your decisions based on what the patient needs, not on what the hospital administration wants or the insurance companies or attorneys from certain carriers force upon you. Recently, HMSA has instituted a policy, well, I'm a pain management doctor, whereby people need to go through a somewhat lengthy process compared to what it once was in order to seek treatment for specific procedures. Workers' compensation claims definitely can be dragged out for months or even years before the patient receives appropriate care. If somebody needs to have surgery on their spine, for instance, and they have a workers' compensation claim, and several physicians have agreed on that, it will still be litigated in a lengthy manner, and sometimes for years.
He said, I don't need a surgery, and he declined me, he denied my surgery. And I've never been in so much pain as I am now.
They can see the pain. I mean, they're always asking me the same question. Are you okay? Of course I'm not okay. I'm hurting.
The independent medical examiner system in Hawaii is something that can be easily fixed. Both sides' counsel should be able to mutually agree upon an independent medical examiner. It shouldn't be dictated by the insurance carrier, because obviously they're only going to pick people that are going to side with what they want. And generally speaking, I would say 19 out of 20 independent medical examination reports lead to the same conclusion, which is this patient doesn't need to be on medications, does not need further therapy, needs only home exercise and Tylenol, and should go back to work.
Here we are with a treating physician who's, in theory, got no bias, and then the insurance company wants to hire their own person. I call them defense medical exams instead of independent medical exams, because in almost all cases they are.
And patients need a second opinion. Let's be honest about it. They need a second opinion occasionally. And when that happens, that they have an impartial physician that looks at it, that doesn't have an agenda going into the examinations.
Independent medical examiners do for the insurance companies. These people are supposed to be trusted medical professionals, and they're using their positions and their training and licenses against people who have true injuries. And there's some amount of lack of ethical responsibility on their parts. And I know it's been brought up in the legislation many times. It would appear as though somebody's influencing who's ever on these committees to sit on or make disappear these reasonable bills.
Hawaii's insurance industry is mounting a coordinated PR, lobbyist, and internet blogger propaganda attack on Hawaii doctors who dispense medication directly to their patients. They sponsor well-funded campaigns to enact anti-dispensing legislation bills. They allege the overprescription of opioids, high prices, and price gouging as the primary reasons. The basic premise of the anti-physician dispensing bills that direct dispensing of medicine by doctors has become an unnecessary cost burden is refuted by both the Hawaii State Insurance Commissioner's annual reports and the insurance industry's own NCCI data. The evidence does, however, indicate that physician dispensing actually creates value and does not impose undue cost or safety burdens. The majority of local doctors actually dispense at rates far below the national average. Another major insurer claim is that physician office dispensing leads to the greater misuse of prescribed opioids. In fact, the U.S. Centers for Disease Control and Prevention published a report on July 1, 2014 that indicates state-by-state prescription rates for opioids. The highest prescription rates are in the Southeast, led by Alabama, where providers wrote 143 prescriptions for every 100 residents. The state with the lowest rate is here in Hawaii, where providers wrote 52 for every 100 people, nearly 3 times fewer. Patients prefer point-of-care medication dispensing because it offers patients the convenience of not having to make an extra stop and waiting in line and/or for the insurer's approval of the payment at the pharmacy.
You have, a great system for them in order to get the medications that they need, no out-of-pocket expense, convenience, and of course, all of my patients that I have in-office dispensing for opioid or narcotic medication, it gives me a way of dealing with them directly. We're giving them the medications, they're signing them for in our office. It gives me, then the nurse in my office, and the medical assistants all discuss these medications with these patients. And it gives another form of confidence and between the physician and the patient, and trust. If you think about it, somebody's coming to the office, they're getting their medications from me, I'm going over it with them, then the nurse does, then the medical assistant does, making sure there's not any diversion of these medications to the street and that they're taken appropriately. I think the toxicology testing, what I use in my office is urinalysis, quantitative and qualitative, and it's a great tool to have in place to go along with the office dispensing, especially because it gives another level of interaction within the clinic. All of my patients that I have in-office dispensing for are on lower doses than the patients who come in from other doctors' offices to see me for pain management procedures. If you've forgotten to put a period at the end of a sentence practically, or you make one small mistake, they reject your entire treatment plan based on a technicality rather than what the patient actually needs. It really doesn't relate to what the patient needs.
Work comp is so much more difficult even than what we've talked about so far in primary care for a physician to make a living, that patients have sometimes a great deal of difficulty finding an occupational medicine physician. I have a little friend. I close the door, and this is not simply an electronic health record that makes it efficient and easy to check the records of my colleagues and order medication to the pharmacy so it gets automatically faxed. This is a monster that has obligatory feedings continuously. So I have to feed it. I have to engage in a myriad of compliance factors as I practice, such that if you're my patient and you're telling me what pains you, what troubles you, what bothers you, I'm conflicted. How much can I look at you, and how much do I have to look in my box and type and feed the monster? So there's this monster that's helping me in one way, but it's also pulling me away. There's a part of it that's pulling me away from the soul of medicine. There's no waking up in the morning and being a kind, compassionate doctor and simply coming and practicing medicine and going home at the end of the day and only focusing on patients. The physician today who chooses not to be a blue-collar worker can only be a physician warrior. This age, the Accountable Care Act, this age in medicine, has given birth to the blue-collar physician and the physician warrior. There's no middle ground.
We've got people that are second-guessing us now and taking a look at how we practice and telling us whether we're practicing effectively or according to the algorithms that have been set up or the standards of care that have been set up. So that's something that, it's kind of a double-edged sword. It's we want to make sure that we provide quality care, but it's uncomfortable to have your practice style scrutinized. Or at least used to be a reverence of the practice of medicine and the people who have devoted themselves to it. And I think part of that kind of carries over that it should be above the pursuit of finances. The cold hard truth of the matter is that going into medicine is a big investment, and the debt that the students are coming out with is huge. Approaches $200,000 for each medical student that comes out. So they've got essentially a home mortgage before they even start practicing. You've got to go through your 4 years of undergraduate college, so get a bachelor's degree. Normally it's in one of the science fields. And then you've got to take the MCAT, which I can't remember, the Medical College Aptitude Test, and score like toward the top of that. Apply to medical school. Only about less than 50% of applicants to medical schools ever get in anywhere. So you got to make the cut there. And then 4 years of medical school. And then after medical school, anywhere from 3 to 7 or 8 years of postgraduate training as a resident or a fellow before you go out and start practicing. So after high school, you've got 4 years of college, 4 years of medical school, at least 3 years of postgrad training. So 11 years after high school minimum. The old paradigm of Marcus Welby, where we had the one kind, caring physician that knew everything about you and took care of you from cradle to grave, is kind of it's disappearing.
To remain in private practice, to go into private practice, Marcus Welby is dead. We are at the most pivotal point in the history of medicine in terms of the role of physicians. 2014 is the Alamo for the physician role in healthcare. When you have an employer or an administrator that's trying to wring the costs out you will wring the costs out, and you will wring out the soul of medicine, the marrow of medicine. The physicians in Hawaii have one chance to salvage their role in healthcare, and that is to make their own accountable care organization, their own physician health organization, and work as a group, as a unit, to negotiate with Medicare and with our large private providers.